What's interesting about another study that came out is, we always talk about how diet and exercise is a way to go to lose weight and help with diabetes. But I was actually quite surprised that the recent study that just came out, and it was published in JAMA Surgery, that weight loss surgery, whether it's gastric bypass or gastric band, could be better than diet and exercise. This is very interesting. It's a small study, but they looked at about 61 obese patients. And they basically did a study. Half of them went for surgery, and the other half actually went for exercise and diet. And what they found was that the patients that got gastric bypass and gastric band in 3 years, they had way lower chance of diabetes. In fact, immediately after the surgery, their blood pressure went back to normal. And so, as much as I don't want to promote these surgeries, they do work. Obviously, you need to have a nutritionist along with you once you have the surgery to make sure that you don't gain the weight back, which is one of the big issues with some of this. Finally, in the news, there's a weight loss drug that shows promise, but there are some side effects. This is called Saxenda, S-A-X-E-N-D-A. It's an injectable diabetes drugs, and it was approved in Canada. But recently, they are using it for obesity. So for people who don't want to do exercise and lose weight, this medication, which is being used for diabetes, can actually make you lose weight by 5% of your weight. They looked at about 3,700 participants and patients, and they found out that the ones that are using this injection for diabetes treatment, they lost about 20 pounds in a year. There are some side effects to this: nausea, diarrhea, constipation, vomiting. And obviously you can talk to your doctor about this and see if this is something that's good for you. The name of the medication is S-A-X-E-N-D-A, Saxenda. And that's like a big news over here.